Although general anesthetics have been in clinical use for more than 160 years, but the scientists are still not clear about its mechanism of action. Most of the scientists suggest that the primary focus is synapse. A presynaptic action may alter the release of neurotransmitters, whereas a postsynaptic effect may change the frequency or the amplitude of the impulses exciting the synapse. It's also said that the excitatory transmission is effective more as compared to the inhibitory transmission. We know that there are many excitatory and inhibitory neurotransmitters in the brain, and it is suggested that the primary molecular target of general anesthetic is GABA A receptor, which is a chloride channel and is the main inhibitory synaptic transmission in the brain. It is also suggested that the hyperpolarization via activation of ligand-gated potassium channels is also involved as a mechanism of action of general anesthetics. As you know that ketamine is one of the intravenous general anesthetic, but its mechanism of action is entirely different from the other general anesthetic, and it acts by the antagonism of the action of excitatory neurotransmitter glutamic acid. As the general anesthetics are distributed throughout the body compartments, therefore they show their effect on different organ systems of our body. On cardiovascular system, they cause myocardial depression, that is, they decrease the myocardial oxygen consumption. And they all the gaseous general anesthetic like halothane and fluorine, desflurane, sevoflurane, etc., they all decrease the mean arterial pressure. And due to this activity, that is due to the decrease in mean arterial pressure, there is activation of our autonomic nervous system, which causes increase in the heart rate as a reflex response. On the respiratory system, all the gaseous general anesthetic, they possess the bronchodilatory property, which is very useful for the patients who are asthmatic. But because of their pungency, they can sometimes cause irritation of our bronchial tree and can produce cough. They are respiratory depressants and they increase the apneic threshold, that is the partial pressure of carbon dioxide level at which apnea occurs through the lack of oxygen-derived respiratory stimulation. They also decrease the ventilatory hypoxic response, but all these effects are overcome by assisted ventilation. Anesthetics also decrease the mucociliary function, and this can lead to the complications like atelectasis and development of the post-respiratory complications like hypoxemia and respiratory tract infections. General anesthetics on the brain decrease the metabolic rate or the metabolic activity in the brain and decrease the oxygen consumption, and they inhaled anesthetics, they increase the cerebral blood flow. It is an undesirable response in cases where the intracranial pressure is raised, like brain tumors or intracranial hemorrhages, and this response can be attenuated by using hyperventilation. They also produce amnesia and analgesia. On the kidney, they decrease the GFR and decrease effective renal plasma flow and increases the renal vascular resistance. On the liver, they cause decrease in the hepatic blood flow, and they can cause transient changes in the liver function test, but the permanent or the fatal changes, fatal hepatitis, is rarely reported. On uterine smooth muscles, general anesthetics cause smooth muscle relaxation, and we take advantage of this fact in cases like where intrauterine fetal manipulation is required or manual extraction of retained placenta is needed. Now the toxicities or the adverse effects of general anesthetics. The first important adverse effect that general anesthetics cause are on the liver, and it is the hepatotoxicity, and it is called halothane hepatitis. It is hepatic dysfunction that occurs during surgery, and the basic pathology behind this is the formation of reactive metabolites that either cause direct hepatocellular damage or may initiate immune response. It is mostly caused by halothane and chloroform, but the other risk factors like hypovolemic shock, infection caused by blood transfusion, or surgical stress may be involved. Then the second important adverse effect is on the kidneys, that is nephrotoxicity, and the most toxic agents on the kidney are enflurane and sevoflurane because of the presence of fluoridine. And sevoflurane is famous for the initiation of a kidney condition called proximal tubular necrosis. Then malignant hyperthermia, as you already know that it is a genetic disorder of skeletal muscles and it occurs in susceptible individuals. And here the succinylcholine, which is a skeletal muscle relaxant which is given in general anesthesia along with anesthetics, is the main risk or the precipitating factor that initiates malignant hyperthermia. And the pathology or the biochemical abnormality behind malignant hyperthermia is the increased concentration of calcium in the cytosolic at the cytosolic level, and you can treat it by giving the patient dantrolene, which is used to reduce the calcium release from cytoplasmic reticulum. And other measures are taken, symptomatic measures are taken like to reduce the body temperature and to restore the electrolyte and acid-base abnormality. And finally, megaloblastic anemia. It is caused by prolonged exposure of to the patient of nitrous oxide, but it is not clinically established adverse effect. Now we will individually discuss some of the inhaled anesthetics like nitrous oxide. The advantages of nitrous oxide gas is that it causes rapid induction and rapid recovery. It is strong analgesic along with anesthetic, and it is safe and non-irritating. It is used along with intravenous drugs for the induction and maintenance of anesthesia and emergency management of injuries. It is also used for post-operative physiotherapy. Halothane, one of the volatile anesthetic, has fast induction rate and anesthesia occurs in 2 to 3 minutes. It is best indicated for pediatric patients. But the side effects are that it causes cardiorespiratory depression, and the most famous adverse effect of halothane is on the liver and causes hepatotoxicity. Due to cardiac depression, it causes hypotension.